that's basically a talk all of its own. So I'll answer the others as we go through the talk. The first thing I wanted to chat about, though, was last week I was asked to go to the AIS to attend some meetings and a presentation that they were giving, and they asked all the Olympic disciplines to send a representative to this talk, which was about training loads. And I was actually very reluctant to go because it took a whole day to go down there, and I thought, well, what's this going to mean for us in equestrian sport? But it ended up being very interesting, and there's two reasons I want to chat to you guys about this. One is because I think we can take a bit out of it and apply it to what we do in our horses, but also because they're very keen for us to do some research ourselves, which could help us to learn about what our horses are actually doing. And so basically what it was about was the fact that they've gone and analysed the training loads of athletes in a whole heap of different disciplines. In fact, just about every Olympic discipline, with the exception of ours, where the athletes obviously are our horses. And what they've found is that there's commonality in terms of timing of injuries in relation to the stresses that these athletes are put under and when injuries occur. And so what they found is that most injuries occur either in training after a spike in load, and that spike in load can either be a competition or it can be something like a camp or a particularly hard training session. And they found that they could link the injuries generally to things that had happened 1 or 2 or even 3 weeks before the injury actually became apparent. That obviously doesn't include things like catastrophic injuries, which happened at the time, but this sort of piqued my interest because it's what I see a lot, where we see these horses not necessarily straight after a competition, but 1 or 2 weeks after, and have a lot of trouble knowing what actually happens. And so in discussing, I also have meetings with their head of biomechanics and their head of physiotherapy, and outlining the injuries that we see in jumpers, and that I would call repetitive stress injuries, they actually say they see the same things in people, and they're actually due to inadequate training loads. And so the first question they asked is, what sort of training loads do we have? And the problem I had is I'm not able to answer that question because everyone's so different in terms of how they train and what they use to train that it's very hard to get a standardized thing. And we'll come back to that in a couple of slides. What they did say is that we need to be very careful about how we reload or how we bring horses back to work after periods of rest. The other things they were talking about was that we can really improve performance and protect against injury by actually increasing the amount of work that we do in training. Now, that's not necessarily applicable to us because I think we're actually pretty good about exposing our horses to stresses. But for any of you that don't do a lot of jumping in your training, that do mainly flat work, then that's something that you do. And I'm happy to chat to you guys more outside of this to try and help you in terms of maximize the work you do to minimize the injuries that your horse has. They also had a very interesting table that they use, or not that they use, that they've asked all sports to use to consider when bringing athletes back from work. And I found it looks very complicated there, but basically if you have a look across, so they've highlighted the 2 weeks of training. What they're saying is that if you do nothing, so if you go straight to rest as an athlete or as a horse for 2 weeks, then you need to take 4.5 weeks to come back to full work. And so if you give the horse 6 weeks off doing that, you need to spend 7 weeks bringing that horse back to work. What they're recommending is instead of just doing nothing, they think the optimal is to have athletes working between 40 and 60%. And that doesn't mean for us, that doesn't mean you have to be jumping in this example. It just means that the horse needs to be picking over. And so I guess what I took home from it was that we need to consider doing things when we might actually have otherwise box rested the horse. And so by that, I mean maybe doing some walking, doing some trotting, just so the horse is still ticking over so that we can get it back to work quicker. Does anyone have any questions about that a little bit? So the reason I've raised that is that I'm about to apply for funding to be able to track loading our horses. And so what I wanted you guys to think about is whether, if I do get the funding, whether you'd like to be part of a trial which would allow you to map what you do with your horse. And what I'd like to do is to get a very easily wearable GPS set up along with an accelerometer, which will tell us when the horse is jumping, how fast it's going, and the distances it goes in training and in competition. And what I want to do is get approval for you to wear those both when you're training at home and at competition, so that we can map what your horses are doing over the course of the year. So I'll throw that out there. I haven't yet got funding from the government for it, but that's something that the AIS is very keen to work with us on, so that we can track what horses are actually doing. And what you guys can see is how much you're actually jumping your horses, and also how much work they're actually doing. So if anyone's interested in that, then just drop me an email after this, and I'll keep you in mind once I get it up and started. So that's sort of what I wanted to present to you in terms of the load management stuff, just basically outlining that we don't know very much at all. Does anyone have any questions so far? Because I certainly want this to be, and from now on I promise it will be, I want this to be more interactive than our excellent nutrition talk the other week.
Robin, can you hear me?
I can.
Oh, hi. Look, that sounds really good. Is that sort of fairly similar to the KER research with the Clocket?
And I didn't know that they did that. Yeah.
Because
what have they done?
It's such an interesting thing to be able to track, the distances of your horse and where you're going and what you're doing with it.
Yeah.
To be able, especially when you've got sort of that repetitive strain that you do get with horses, and not knowing, do you hard ground walk them, or all of those sorts of things just to keep them going, and does the muscle strength of the horse deplete in the time you're putting them out? Yeah,
correct, absolutely, and certainly that's what I'm interested in knowing also. How many jumps do our horses? Because that was the first question that the head physio asked, is how many jumps are these horses doing per year? And you can calculate what we've done. If you look at what shows you've done and what classes you've done, but also you need to take into account obviously how many warm-up fences you do for each class, and how many jumps you do in training. And that's why they've been able to put this data together for people, is because they're able to map so accurately their training loads.
So if anyone else is interested, do you want to type a message in the box there to say that you might be interested in putting and being part of a research to see if you can, choose one horse and track it? Anyone interested in that? Just type a message in the box. No, okay.
That's fine. The other thing that potentially might happen in the future as well is they've got probably one of the best biomechanics labs in the world with a heap of force plates and things. Is I'm going to want someone at some stage to bring their horse down to the AIS, and we're going to jump it indoors and try and break their force plates. So,
Sure.
So that we find out what horses are on there.
Research,
yes.
It won't be specific, like obviously people want to be private about what they're doing with their horses, but it'll horse number,
correct.
what it is, and some data, and then the riders will be able to actually be given that research data themselves for their own record of their horse and kind of.
Correct, exactly. So what would happen is the only person that would know whose horse it was would be the rider and myself, basically.
That sounds great. I'd like to do that from here with a horse.
Well, and it actually can happen there as well, but I'll start locally first, and we haven't even got this off the ground, but I just thought I'd throw that out there as something interesting to start the talk off. What I'll do now, guys, is we'll head towards your questions, and the greatest majority of the questions were about Pentosan, basically, or joint therapies. And I guess that's because most of us have these medications in part of our management regime, and that they're expensive, basically. And so we want to make sure that we're using them right. So we know that Pentosan does a number of things, and it has anti-inflammatory functions, so through things like decreasing certain inflammatory agents, like I've got on screen there. IL-6 is the main one, which is a big pro-inflammatory mediator. It increases synthesis of hyaluronic acid, which is also the constituent that's in drugs like Halo or Legend if you're in the States or Europe. And it's been shown to decrease pathology in horses with experimentally induced osteoarthritis. So what we see is that in horses where, and the research was done on horses where they made chips in horses' knee joints, and then exercised them on a treadmill, and after 6 weeks of treatment with Pentosan, looked at treated and non-treated horses and had a look and see what the differences were. And so treated horses, they saw less cartilage fibrillation, so there was less damage to the cartilage, and an increase in chondroitin, which is that CS846, chondroitin production in the joints that had been injured. The important thing, and we'll come back to this when I address the questions around this, all these studies used a dose of 3 milligrams per kilogram IM once weekly. So if you're using Pentosan, that's 6 mils. If you're using cartrophin or arthropine, you need to be careful because those are a much weaker solution. And so in cartrophin, that dose is equivalent to 12 or 14 mils, depending on what your horse is, rather than the 10 that's the label recommendation. So one of the most common questions is, what is the most effective way to use Pentosan? And following from that is, can Pentosan be given intermittently? According to the research, the ideal dosing frequency is weekly. And so it sort of depends on why you're using it. If you're using it to prevent arthritis in a young horse, then giving it monthly is fine. But if you're doing that, then you shouldn't do what quite a few people do, which is to have a break for 6 months from it. When they come to a big competition, give it once weekly for 4 or 6 weeks, basically. If you want to use it as a preventative, it needs to be given at least monthly. To make your horse jump better or feel better at shows, especially multi-day shows, which is another question which I'll address shortly, I would give it weekly, and I would give it a couple of days before the show. The ideal way to give it is intramuscularly. And I say that that's just because that's the label recommendation, and there have been problems with horses, and horses actually dying, having been given it intravenously. Now, what a lot of the guys are doing is to use it IV at shows. And the reason for that is that it can cause pain in the neck muscles when you give it IM. And so the studies on it have shown that actually the highest concentration in the joints for the Pentosan was seen 24 hours after administration. If you're going to use it IM, I use it 2 or 3 days beforehand because I worry if we're giving it the night before a big class, the last thing I want is your horse to come out with a sore neck. And so if we have 2 or 3 days to be able to deal with that, it still works, but maybe not necessarily at its maximum. Did that answer the people that asked that question? Is that what you wanted to know about Pentosan? Do you have any follow-up questions?
If anyone wants to ask Robin a question, just unmute yourself and speak now, or type a message.
Type if you want. Yep. And Annie can relay it because I can't see.
Yeah, I'll just read it out. No, I think that seems nothing's
really good.
just yet. I'll just if someone types, I'll just let you know.
Yeah, perfect. Thanks, Annie. So the next question was, should corticosteroids be injected for prevention of arthritis? And that's a really good question. So I guess I'll answer it by saying what corticosteroids do. So they're really potent anti-inflammatories. So inflammation, so secondary to arthritis or secondary to trauma, is really bad for the joint. and it causes all sorts of damage to cartilage. So the joints are meant to be really nice, pristine environments that are really low friction. And they have that by having really healthy cartilage and healthy joint fluid. And so everything glides and slides really well and absorbs shock really well. When there's inflammation, that cartilage is damaged and it leaks out all the things like the hyaluronic acid and the water content and everything, and so it becomes less cushiony, for want of a better description. Now, the corticosteroids shut down the inflammation that causes those secondary changes within the joint. So they're extremely good for that. However, at really high doses or at very frequent doses, they're detrimental to cartilage, so they cause damage. And also, whenever you inject a joint, as many of you will know, your veterinarians will have told you, there's a small risk of infection. So in answer to the question, should they be used for prevention of arthritis, my answer is no. So I basically do not recommend that in a normal joint that doesn't have any inflammation in it, we inject corticosteroids to prevent arthritis. Now, in a joint that shows clinical signs of inflammation, like there's swelling in the joint, or the horse is painful to flexion tests, or blocks out, I absolutely use them. I use them in very low doses and in conjunction with hyaluronic acid. And this is where I have a lot of problems with the European veterinarians who are so against the use of corticosteroids in most cases, although they actually all use them, that I think that they miss the beneficial effects. I think used judiciously and appropriately, there's no better drug for the joint than low-dose corticosteroids.
Sorry.
Does anyone have any questions? Yes?
I have a question. Why would the European-based vets sort of be kind of saying that? Is it a trend? Is it some research that wouldn't do that?
Yeah, so I think that they're based on the high doses that were used in the 70s, and it's frankly wrong. And so even the vets I know in Europe that say they don't use them, they actually do use them. They use dexamethasone, which is really short-acting. But the same sort of studies that showed the beneficial effects of pentosan have also shown the chondroprotective, so the good effects of low-dose, short-acting corticosteroids in those joints. And actually, the European vets that won't use corticosteroids use hyaluronic acid, which is actually more inflammatory when it's injected in the joint than corticosteroids are. So what they're using is actually worse for the joint than corticosteroids.
Okay, thanks for that. Any other questions? Anyone? Okay.
Great.
No.
The next question, which I wish I actually had the proper answer for, is how do I make sure my horse stays sound? There's no tried and when I mentioned before that we don't really know the loads that our horses are subjected to over a year. There has been one study done in show jumpers looking at a number of yards in the UK, the Netherlands, and I think Denmark, and comparing 35 high-performance show jumping stables. They found, unsurprisingly, that what horses do is extremely different yard to yard, and so they weren't really able to make much of the data, so it wasn't really a very useful study, just because there's so much difference between what people did. You know, the mean time, the average time horses were worked per day ranged from like 50 to 75, and they jumped on different days, they did different things. But the one thing that study showed is the horses that were the soundest were those that did cross training. So those that didn't just jump in one arena, that actually hacked out or did a little bit of dressage or worked on different surfaces. Those horses were the soundest, or I should say, had the least days off from injury. And so for me, the most important thing to make sure that your horse stays sound is to make sure it's fit, exposure to some cross-training, and make sure that you're jumping the horse on a good surface. And preferably jumping the horse on a surface similar to what you compete on. And for those guys that were out at Yamdu, it's one of my big things that I push, is that we should be jumping and training our horses on the same surfaces that they're competing on, so that they're exposed to regular or the same loads, both in work and out of work. And this is for you, Clint, because you're a good farrier. We need to have excellence in farrier. So we need to make sure horses are regularly and well shot. And that involves having a good professional relationship with your farrier. A lot of the other questions, yes?
Robin, there's just, and I'm sure, I don't know how long ago Clint put this up or put it out, but he said
yes.
so pentazan is a preventative and cortisone is a short-term treatment.
Yeah, absolutely right, Clint. Yeah, for sure. I do use pentazan as a treatment as well, so I do think it helps with mild, low-level lameness. But yeah, exactly. I don't use corticosteroids as a preventative. Yeah, just as a short-term treatment, basically. And that's, I think, if you overuse corticosteroids, the worst arthritis I've ever seen was over in the States, basically, with reining horses that are medicated again and again and again and again and again. And those horses end up breaking down because absolutely in high doses and in high exposure, the corticosteroids destroy cartilage. Icing, I think, is really important, and I think it has a real place. I recommend that we ice as regularly as we possibly can, preferably after every strenuous exercise. I also really like to use anti-inflammatories as well. So I like to use like phenylbutazone whenever we can, or bute basically. And that's not at a high dose and not on a very regular basis, but I really like using it after shows. So for a couple of days after a show, provided you're not backing up the next weekend, I'll use bute. If we are backing up, then I'll use something that swabs for a lesser time, like Metacam, basically. And I think that's really helpful to horses to help, the same as corticosteroids or other things minimize inflammation in joints, so do systemic anti-inflammatories like bute or Metacam.
Can I ask
yes?
Just in regards to bute after an event, I think that the cut-off time, correct me if I'm wrong, is half an hour after the prize giving of a class that you might be called for.
Correct. Yeah, so until 30 minutes after the prizes are presented, you could still be swapped. So yeah, I certainly would wait until, and saying that your horse has finished competition and you've just given bute, you'll still be hit with a positive swab if they test you within that time, basically. So it's not events to say that.
Sorry, what would be the best way to actually give bute at the end of an event? Is it good to do that before travelling, or as well if you've got a long distance post event?
Yeah, really,
Yeah,
great question. It depends. So the side effects of bute are actually, everyone thinks it's gastric ulcers, and it actually doesn't cause gastric ulcers. The side effects are predominantly to do with the kidneys. And so bute in a well-hydrated horse, so that's not dehydrated, actually is very, very safe. So if your horse drinks well at a show and is going to drink, as you travel it, I would give it before you leave to travel, basically. If your horse hasn't drunk well during the show and you don't think, and you've got like a 12-hour trip, I would probably give it once you get home and once the horse has had a good drink.
That's great advice. And also, how would you administer that bute?
Yeah, I don't think it matters actually. So orally or IV. The only thing I don't like about the IV bute is if you get it outside the vein, it's really nasty. And so I prefer to just recommend they have paste, to be honest.
Okay.
It's well absorbed and causes minimal problems. So
would you provide,
that's really
would you administer anything else directly after an event at the end of a show before you head home, other than something like that? And is that sort of something that people kind of do on a regular basis, or is it only when they think a horse is,
It depends on the person. So quite a few of the top riders, in fact, most of them use Bute or Metacam after a show, and I think that that's really wise. Um, in terms of other things you can use, I like some of the recovery paste on the market. So from Ranvet, that's called BC5A, which is a branched chain amino acid paste. I think that's really good for recovery. Lots of people give electrolytes, and our horses don't tend to lose that much electrolytes, really. If they've been eating and drinking, they tend to do just fine. So for me personally, I mainly go with the anti-inflammatories.
Any questions?
Yeah, any,
Or am I just asking?
and I'll also go through the other anti-arthritis products a little further down in the talk too.
Okay.
Uh, the other question, which is similar to the above one, how do I make sure my horse stays sound at shows? And this is more towards how do we make sure we get the most out of our horses at multi-day shows? Or, like a lot of us do, is to have a run of shows together. How do we make sure those horses are backing up from show to show? And I guess for me, the most important thing is to make sure that these horses are on the same diet they're on at home, provided that's a good diet, and that they have a normal intake of water. If a horse is well fed and hydrated, then most of the stuff that we give them is superfluous. And that sort of comes down to what we use at shows. A lot of the top guys, especially in Europe, are injecting their horses with quite a few things at the show to try and help them and to make them feel good and jump better. And these aren't illegal things, but they're things like B vitamins and other things. And to be honest, the horse is so good at making that stuff. If they're eating well, then there's no need for them. And so that's sort of why I put the feed and water intake is normal, is important. Now, the problem we have is we go to a show, the horse doesn't eat, it doesn't drink, or we can't get the same hay it used to have, or that sort of stuff. Then I think we need to talk about how we intervene. And so I usually start with the oral paste for that. If your horse is still a bit down, then and you need to be a bit careful in terms of injecting, especially at FEI shows, actually needs to be done by a veterinarian. And so you can go to the treating vet and ask them whether they will, you say, oh, my horse isn't eating, isn't drinking, what can you do? Can I give him this? And then you recommend a vitamin B12 or something similar that may well help them out. And so that's something you can do while you're at the show. Another question is, what should we do after our rounds? And for me, make sure that we don't just come out and stop, basically. So make sure you trot the horse after it's finished, walk it, and cool it down. Okay, so that just helps the horse's muscles recover, make sure blood's still flowing to them, and helps to remove lactic acid from their muscles as they're warming down. I really don't like icing the horses between rounds. My worry for that is that I sort of want them not to be dead in their legs when we're going to be jumping them. And so I leave icing until after we've finished, not necessarily for the day, but I wouldn't ice between rounds in a single competition. You can certainly ice them after they've finished the first competition for the day, but I don't do it between rounds as a routine.
Okay. I have a couple of questions. Kirsty has asked, what oral paste would you recommend as her horse does not always eat or drink well at a competition?
Two, Kirsty. One would be Tripart. Is a really good paste from NatureVet, and the one that I like best at the moment is, it's a little expensive, but is the BC5A. So that's for BC is branch chain, and then 5A is the number of amino acids it has, and that's available from Ranvet.
Okay, and also a question from Reese. What's your recommendation for eating, drinking prior to competing at an event, time frame and the amount, etc.?
Yeah, good question, Reese. I I don't think it makes that much difference to horses. They're a lot different to us in terms of, us drinking a heap and eating a lot before we go. Do I like horses to have a huge bucket of water before they jump? No, I don't. But for me, I don't restrict their intake because I think it is important that they're well hydrated and eating well. Do I give them a big feed before they jump? Again, no, but I don't mind them having hay during the day. So I don't think it's as important as in humans, and I'm not too prescriptive about it, if that helps, Reese.
That was Jess actually, but they're logged in. Jess is asking the question. Thanks, Jess. That's all questions for the minute.
Yeah. The next question was, are oral joint supplements worthwhile as part of a preventative maintenance routine, which I thought was a great question. That's a hard one. So I honestly, and I actually had looked up what the recent papers are, and I've put a couple of them there. So there's been 2 recent studies done looking at the effects of oral glucosamine and chondroitin sulfate, along with MSN, at least in the Equine Veterinary Journal one, and another one looking at how much of the stuff that's given orally, pardon me, is found in the horse's bloodstream after they've eaten it. And so that first one in the Journal of Equine Veterinary Science actually fed these horses the recommended amount of glucosamine and chondroitin sulfate for a month, and then looked at how much of that was available each day. And what they found is that there was almost no oral bioavailability of these substances, which is not great because most of us feed them, basically. Now, are they bad? No, not at all. And could they potentially have beneficial effects? Maybe. There's 2 things orally that have been shown to have efficacy. One is hyaluronic acid, so the oral HA is really good. And the oral glucosamine, I'm really on the fence about, to be honest. I don't think that either of those studies that I showed there were actually good enough to say that it shouldn't be used. So one of the things I always look at when I'm reading journal articles is which journals are published in. So the Journal of Equine Veterinary Science is not a very good journal. So there are some major flaws in that paper, but I thought it was interesting that even with the flaws in how they fed the horses and how they processed the samples, it didn't show really high levels. So that makes me worry a little bit about that. The one looking at how it was, they were old horses, and I think that's a pretty tough ask. That's a different, looking at geriatric horses, we're talking about minimizing arthritis in our high-level performance horses. So it's not really comparing apples with apples, but it just doesn't mean, for me to recommend that people spend money on things, I need to be convinced that they're almost certainly going to be clinically effective. And I'm not there yet with any of those oral products that we've discussed. Oral HA is different, and to be honest, so is the Foresight, which is a new product on the market. It's relatively expensive, but it is something that I do really like. The research behind that is quite strong, so it has been shown to have excellent clinical efficacy, but again, exactly the same as my criticism of the glucosamine and the chondroitin sulfate, is that the Foresight, they haven't done studies showing that it's orally bioavailable in the horse, and that worries me a little. Often these companies have actually done these studies and don't publish them if they don't show favourable results. And so I know the guys that run the company Foresight really well, and that's the thing I'm often pushing them for. If they publish that data, then I'll be very gung-ho about their product. Products that I also like as preventative, I really like a relatively new product new in Australia, product from Bova called polyglycan, which has glucosamine, chondroitin sulfate, and hyaluronic acid, all available for IV use. And the other thing I like is IV glucosamine as well, whether it's in the Penisan Gold or whether you give Penisan and glucosamine. And I think they were most of the questions covered. Will, if you're on, I didn't answer your one about mares and cycling, because there's nothing that's really effective in the long term for them other than oral progesterone. You certainly can give injections of progesterone or put implants in, but again, you tend to have problems at the injection sites in my experience. So unfortunately, the oral formulations tend to be the best. Is there anyone's
Will is
questions
actually online. Hi.
Hello, Will.
So does that kind of answer your question? We'll just, if you can type in something to us. Otherwise, I guess a conversation with Robin. Yep, he's saying yes. And, yep. Okay, Robin.
Did I miss anyone's questions?
Anyone else with a question? No, it seems to be pretty good, Robin. Thanks very much.
Oh, sorry, Reese did ask about bandaging versus boots, I think, or what's best to do after competition. Icing, I think it was magnetic boots, bandaging,
mud poultice,
or boots. Poultice.
Yep.
The answer is probably all of those things. The magnetics, boots or magnets in general, have never been shown scientifically to be clinically effective. I guess I feel that they don't hurt, and especially because you guys are good enough generally to, if you can get sponsored, to have the companies provide you with them. I don't think they hurt one little bit. I really like bandaging, but I'm always loath to recommend it because it's a lot harder to go wrong with boots than it is with bandages. So if you put bandages on badly, then you end up with really serious consequences. So I personally prefer bandages because I think you can get nice even pressure. If you have good padding, I think it keeps swelling out better than any boots. But I don't generally recommend them to clients. I guess I'd consider you guys to be better than people as I define as clients, and very careful with your bandaging, so I think that they're great. The clay poultice, I really wanted to not like, but I certainly tried it, at least in eventing horses, where you do one horse's leg with the same horse, one leg with poultice and the other without, and the other leg will invariably swell a lot more than the one with clay poultice. Again, there's no scientific evidence for it, but it's something that I really like and I recommend as my routine. And I think most of our top riders are using it.
Can I just a question in there? There is another rider with a question in a minute I'll ask. But when you put those sort of poultices and things like that on,
yes.
What's is it if they have a cut or a sore or something like that?
It's actually fine for open wounds, and some people actually, I don't recommend it, but some people actually put poultice onto wounds to help get inflammation out of it, because it's not actually the dirt per se that's a problem with when we think of dirt in our wounds. It's the bacteria associated with it, and these clays tend to be pretty benign in terms of their bacterial flora. So yeah, I don't worry about cuts. It actually, for some reason, tends to help, to be honest.
Okay, and another of the riders wanted to know, what do you recommend as a minimal maintenance dose for glucosamine and MSM orally?
Orally, yeah. So the studies are done on, I think, 9.5 grams on glucosamine. I can't remember what the MSM dose. I can send you the paper. I question whether we can get the doses high enough to make enough of it bioavailable, at least in the horse, to be effective. So I actually don't recommend those oral products, but I don't have enough evidence either way to really pan it. I just don't routinely recommend them to my client. And it's got to be on a cost-benefit basis. The problem I have with the Foresight, which I like, is it's actually really expensive. So, and again, I can't hand over heart say that one really works. So what I generally say to people is to have the product with the highest amount of the active ingredients, so glucosamine, chondroitin, and MSM. And if it's got the most of that available, then I think that's the best product to use. When you talk about hyaluronic acid, you do need to look at molecular weight because they're not all the same. And so the higher the molecular weight of the hyaluronic acid, the better. So to sort of answer your question is, I would use the product with the most of the active ingredients in, and there are differences amongst them, and also cost has to come into it too. So does that help?
Yeah, okay. And Sarah Beale has asked the question, have you looked much into the back-on-track products compared to magnets?
Scientifically, no. On my patients and on our own horses, yes, I really like the back-on tracks. I don't own any magnetic boots, so I haven't actually directly compared them, but I really like back-on tracks. Is my answer to that.
Okay. I don't know. Someone seems to be typing. I'm not sure. It's not me. There's another question. Sorry, someone wanting to say something?
Yeah, hi Annie, it's Nicole.
Hi, Nicole.
Hi.
Nicole.
I just have a question hi Robin. My big mare, she's not a huge drinker, and especially as I do travel quite a lot. I mean, sometimes I do give her molasses water, but I try not to give her too much. And of course, when traveling, I make sure, she's getting a little extra more electrolytes and she gets recharge, and, I try and stay on top of it. Is there anything else that you could suggest that I could try that could get her to drink a little bit more water whilst traveling?
No, I think they're all the things I do. I do like the molasses water in terms of my worry with these horses, especially in our conditions, is the water is so different from place to place and state to state. And so having them used to drinking molasses water, even though it's not ideal, does actually get the water into them. And I don't mind a bit of molasses in. I think it's actually fine for them. So, and recharge is great. I just try not to overdo the theory with electrolytes is we feed them the electrolytes to make them thirsty so they drink. And that's fine because the kidneys really, the horse's gut is very good at selectively absorbing stuff, but I just worry a little bit about if it goes too much the other way, you can end up actually, and they don't drink enough, then you can end up making things worse. So, yeah, recharge is great, and a little bit of electrolytes. Even the tripart paste actually really helps encourage them to drink as well. And that's all you can really do, to be honest. Once you're there, you can always, if there's veterinarians there, you can ask them whether they'll stomach tube the horse, which is a good way to get fluids in them. Or worst case scenario, if you're worried, we can actually put them onto fluids, which you can also do between shows if you really need, and that's give them a drip into their vein.
Perfect, thank you.
So any other questions, anyone? I think, Robin, you may have come to the end of your
Excellent
presentation.
Thanks, guys. Don't be shy, and if you want to follow up with anything, feel free to email me. I'm more than happy to answer other questions.
Oh, that's great, Robin. Look, thanks very much, Robin, for presenting. It's always fantastic to have, our team vet, and, Robin's always available, and I know that he speaks to the riders over here frequently. I'd just like to thank very much Will for coming on today. Thanks so much, mate. I know you've had a really hard last couple of weeks, and our sympathies to you, but, we're kind of all around and rally around you, and keep in touch with us all, and I'm sure everyone feels the same if everyone can sort of rally a bit round Will at the moment. And all the best with your performances, everyone. And the next webinar we'll be doing 14th of the next month. If you can sort of pencil that into your calendar, that would be great. And don't forget that for those who haven't sent it in, all your other bits and pieces, the calendars and your goal setting and things are due now, I guess, 30th of June. So if I can have them in next week, that would be fantastic. Thanks, everyone, and log out. Thanks very, very much, Robin, and speak again all soon.
All right, thanks, guys.
Robin, everyone's sending thankses and everything.
That's fine. I can see now. Thanks, Annie.
Yeah, okay, great. Thanks so much, everyone. Ciao.